My name is Angie Goodwin. National Institute of Drug Abuse recorded heroin overdoses killed nearly 13,000 people in the United States in 2015. And this number rises to nearly 33,000 when prescription opioids are included. A local police officer described the drug problem as trying to hold back the ocean with a broom. The drug epidemic is only getting worse and there's no end in sight. Rita Rubin of Forbes believes that we need to start looking at drug addiction as a social and health problem instead of a criminal one. We cannot arrest our way out of the problem. Safe injection sites are proven to lower drug overdoses, eliminate death from drug overdoses, and lower the transmission of hepatitis C and HIV due to needle sharing and other unsafe injection practices. According to the Harm Reduction Journal, the first site was opened in Switzerland in 1986, and there are currently over 90 sites operating in 10 different countries, with none of them in the US. These sites are one of the most researched public health issues, and the evidence of social benefit is overwhelming. Today I'm going to provide information on what these sites do, how they save taxpayer money, and more importantly, save lives. Safe injection sites' goal is to provide clean injection equipment, education on injection, and offer medical response in the case of an overdose. They offer a safe place under medical care for drug users to inject pre-obtained drugs. They must bring their drugs in. You cannot buy or sell drugs at these clinics. And many of them offer other services such as detox, treatment, and counseling, and medical care. And if they don't offer these services, they can get you in touch with people who do. Safe injection sites keep users off the streets. Addicts whose drug of choice includes injection don't care where they get high. They will use in parks, public restrooms, libraries, subways, even out in the open on the street. These sites increase public safety by giving them a safe place to properly dispose of used needles and other drug paraphernalia. In the month of November last year, over 600 dirty needles were found in one neighborhood in Seattle. Could you imagine your kids finding these needles or walking in on an addict and using, or worse, finding an overdose victim? No parent wants their child exposed to this, but in many cities and neighborhoods, this is a reality. Many people believe that safe injection sites just enable the drug user to continue using by making it easier to get high. But a Harm Reduction Journal study finds that these sites don't increase drug use. Addicts get high because they have to, not necessarily because they want to. And the sites don't increase drug trafficking or crime in surrounding areas. Many times these sites are the only access to healthcare that these people have. Safe injection sites save taxpayers money by providing medical care, clean injection equipment, and quick access to the opioid reversing drug naloxone, which decreases the spread of disease and the need for hospitalization. Drug users' high-risk behavior opens them up to a multitude of healthcare risks. They have a high rate of abscesses, infections, and bloodborne infections such as HIV and hepatitis C. 1/3 of addicts suffer from soft skin infections and abscesses, which in many cities are the leading cause of hospitalization in urban ERs. The medical staff at safe injection sites provide sterile equipment, advice, and basic wound care. This cuts down on the seriousness of many of the infections, which oftentimes eliminates the need for the trip to the hospital. The availability of cleaning equipment cuts down drastically on the transmission of HIV and hepatitis C. The Journal of Drug Issues says that with each case prevented, saves the taxpayers over $402,000 in lifetime care of these diseases. Reducing the number of hospital visits and shortening the hospital stays saves taxpayers $2.7 million with the fast treatment and wound care that these safe injection sites offer. This doesn't include eliminating the need for ambulance rides to these hospitals or reducing overdoses, and naloxone treatment does not require further hospital care. With the increase of drug use brings the increase in drug overdoses, and many of them are fatal. Street drugs are easier than ever to obtain, cheaper than ever with a higher purity. Per the International Journal of Drug Policy, drug overdoses remains the leading cause of death in many cities. Safe injection sites offer quick access to the opioid reversing drugs, and according to the Center for Disease Control, lay people use naloxone over 10,000 times since 1996 to save overdose deaths. There's never been a recorded overdose in any safe injection site worldwide, and this is after millions of injections. In a 2011 study of the Vancouver site shows that the rate of overdose deaths decreased by nearly 35% in the surrounding area since the facility's opening. In the Vancouver site alone, naloxone was used over 5,000 times to prevent overdose deaths. In the last decade, heroin use in young adults has doubled in the United States. And heroin overdoses rose 250% from 2010 to 2014, reaching 29 overdoses per day in 2014. What if this was your child? Wouldn't you want them to have every opportunity to be safe and have access to medical care and treatment? No matter what their bad choices and drug addiction has made of them, these are our brothers and sisters, our mothers and fathers, and they desperately need our help. The drug epidemic is horrendous, and it's only getting worse. The war on drugs is an evident failure. We need to start looking at other ideas, no matter how unorthodox they are. The studies have shown that these sites work better than anything that we are currently doing to help. With these sites teaming up with the criminal justice system and treatment and rehab facility centers is the only way that we're going to make a dent in this drug crisis. Thank you.